Hello and welcome to Hep C TV, brought to you by hepatitiscnews.com. My name's Neil and I'm part of the Hep C TV team. Each week we'll bring you the latest news, views and updates on Hep C from around the world. This week we'll be looking at some stories that have made the news and hearing from our Hepatitis C expert, Dr Matthew Foxton. Now for our news roundup. Last week, the US Food and Drug Administration put Achillian's Savapravir on clinical hold after concerns over its safety. A clinical hold is an order issued by the FDA to a pharmaceutical company to delay a proposed clinical investigation or to suspend an ongoing one. The FDA put the drug on clinical hold after elevated liver enzymes were found in a small study of healthy test patients, suggesting damage to the liver. The FDA has allowed Achillian's Phase 2 safety and tolerability trials for Savapravir to continue, so this isn't a full-on no to the drug. We'll keep you in touch with developments. Meanwhile, a doctor behind one of the largest hepatitis C outbreaks in the US has been found guilty of second-degree murder. Deepak Desai, a Las Vegas doctor and endoscopy clinic owner, was convicted after a jury heard how patients were treated with reused needles as Dr Desai tried to perform treatments as quickly as possible to maximise profits. Investigators traced the infections of 9 people to his clinics, but it's thought up to another 105 patients may have been infected. Desai will be sentenced in September. And finally, in what will be a regular feature on Hep C TV, here's our resident expert, Dr Matthew Foxton, consultant hepatologist at London's Chelsea and Westminster Hospital, answering frequently asked questions about Hep C. This week's question: what is the advice for women with Hep C wishing to have a baby?
Women with hepatitis C who want to have a baby, it would often be sensible to discuss and plan the pregnancy. Some women want to be treated before they fall pregnant, and we would recommend that if this is the case, they need to know that we would recommend avoidance of conceiving for at least 7 months after they've completed their treatment, because there are concerns that the drugs that we use currently can affect the unborn baby. In women who are pregnant and have hepatitis C, the risk of transmission is approximately 5%, and that often depends upon the level of the virus in the blood at the time of delivery. But there's no evidence that having a caesarean section, for example, decreases that risk. The other issue is that once the baby is born, it is then sensible for the baby to be monitored after birth with blood tests to see whether they have contracted the infection at birth.
That's it for now. We'll be back with more next week. As always, you can find more on the stories we've covered, along with news and features on our website, hepatitiscnews.com.